I'm Dr. Rosemary Sotolongo here in Ridgeland, Mississippi. I'm a podiatrist. Any foot problems or ankle problems that you may have, we will go ahead and take a good patient history, do a good physical exam, use diagnostic tools such as digital x-rays, ultrasound, to go ahead and evaluate the cause of your foot pain. Diagnostic modalities we have is digital x-rays. It allows for a more accurate picture of the bones of the foot and ankle. You are not alone. It is not uncommon for parents to be concerned about their child's flat feet. As a child's arch becomes more obvious around 3 years of age when the fat pad disappears. At this age, it is normal to observe a good arch when the child is sitting or lying down. We use orthotic devices to control in-toeing and out-toeing in children. We can go with a prefabricated orthoses, or we can make a mold of your child's foot. We can make a mold of your child's foot and go ahead and make an orthoses for your child. For an epidermal nerve biopsy to determine if she does have peripheral neuropathy, we go ahead and take a small skin biopsy and send it to the laboratory, and they'll let us know how the skin nerves, the condition of the skin nerves, whether she does have actual peripheral neuropathy or if her burning and tingling is actually coming from her lower back. So this is a test we have available to us that gives us a definitive diagnosis of peripheral neuropathy. We will take a small segment of the skin and put it into the fixture, and that will be sent off to the lab. Hammer toe surgery is one of the most common surgeries we do here at the Foot Doctor, where when there is a flexion deformity of the toes, we go ahead and remove a small portion of the joint and realign it. We'll use pins to maintain the fixation for anywhere from 4 to 6 weeks. At the end of that period, the pins are removed. And at the end of 8 weeks, the patient's able to return to their normal activities. You have probably seen the colorful tape on athletes and wondered what it is. It is called kinesio tape, and we have seen great results when using it with patients. Kinesio means movement. It's nothing like regular athletic tape that restricts motion to support an unstable joint. Kinesio tape actually allows the joints to move and actually assist in proper motion. Kinesio tape can help improve the flow of fluids from the tissues back into the circulatory system to reduce swelling and improve healing. Kinesio tape is not just for athletes. Lasers are concentrated beams of light with electromagnetic radiation. Lasers can have their intensity levels modulated. Fortunately, for laser therapy, the intensity is dialed down to provide people healing properties that lead to pain relief. In addition to stimulating cell growth, pain relief is a major benefit of low-level laser therapy. Lasers also have an anti-inflammatory property that reduces tissue swelling. When the cells are stimulated, they also promote vascular activity, which cycles more immune cells to the damaged areas. There is also nerve stimulation for people who have numbness. Photobiostimulation initiates some cell functions that promote healing. Collagen production, enzyme production, and cell growth increase. With the collagen level increases, damaged cells become less prevalent, preventing scar tissue from forming. We evaluate the cause of your abnormal nail, and we can send it to pathology to see what type of fungus you have growing. The foot is designed to unlock or pronate when it hits the ground for shock absorption and to conform to variable terrain. When either of these phases are excessive or out of sync, the foot has faulty mechanical function. We use an orthotic as a supportive device to be placed inside the footwear to change the mechanical function of the foot. A lot of foot problems can be corrected through orthotic devices. Here at the Foot Doctor, we can cast you for custom molded orthoses that we make in our own lab. A number of foot problems can arise from faulty foot biomechanics. Among them, bunions, corns, hammer toes, plantar fasciitis, and tendinitis, because foot function affects the entire chain of bones leading to the spine. Pain and dysfunction in the knee, hip, and low back often result as well. In all, there are over 30 common diagnoses related to poor foot function. Peripheral artery disease occurs when there is a buildup of cholesterol and plaque in the arteries of the lower extremities, causing decreased blood flow to the legs and feet. Who's at risk? Men and women over 65 years or older, patients 50 years or older with a history of diabetes, high blood pressure, high cholesterol, or smoking. Signs and symptoms of peripheral arterial disease include pain in the legs brought on by walking and relieved with rest, pain in the legs at rest due to poor circulation, a poor healing wound on lower extremity, injury to the lower limb or foot involving blood vessels, and discoloration of toes and feet. During your test, you will lie down on the exam table. Pressure cuffs will be wrapped snugly around your arms, above knees, calves, and ankles. And one of our technicians will inflate the cuffs, and sensors in the machine will record the pulse volume waveforms that correspond to each beat of your heart. The use of platelet-rich plasma injections in the treatment of fasciosis and tendinosis is a fairly recent and evolving concept. The idea behind such injections is quite simple. The concept is there is a loss inflammatory response and chronic scar formation with fascia and tendon injury. Chronic venous insufficiency is a condition in which leg veins have problems sending blood back to the heart. When the one-way valves in legs are damaged, blood flows backwards. Here at the Foot Doctor, we use a probe and a patented machine to measure the venous refill time of the lower limbs. Because these volume changes are directly related to the amount of blood in the limb, this test helps to identify problems affecting venous circulation. By the age of 50, nearly 40% of women and 20% of men have significant leg vein problems. During this test, you will be sitting upright on a sturdy chair with your feet flat on the floor. We can remove any skin tumors and send to pathology so that we know what type of skin growth you have. And especially if we're concerned with any skin cancers, we want to go ahead and any suspicious lesion, go ahead, remove in one piece and send to the lab. Diagnostic ultrasound is a tool we can use where sound waves are sent into the foot, and the different types of soft tissue will absorb the sound waves at a little bit differently, and we can tell if there's any stress fractures or neuromas in the foot. Ultrasound is a safe and effective tool to go ahead and measure the thickness of the plantar fascia. Once we know the thickness, we can determine which treatment is going to be more effective for the patient's heel and arch pain. It can also be used on pregnant women, whereas x-rays cannot. We use ultrasound-guided corticosteroid injections to improve the outcome of heel steroid injections by determining the exact location of the inflammation.